With remote monitoring, I think it allows more patients to be on the books. We can keep an eye on a lot more patients. Patient and relatives have more confidence when they know they're being monitored, and they're happier with the service, and they feel safer in a service when they know that the team are monitoring them. So yeah, I think it's certainly something that to not shy away from.
Initially, it was quite daunting, and then became a lot more comfortable with it. The more we use it, the more comfortable we become with it. It may generate more phone calls, but it generates less visits. We now don't need to attend. We can just look at the current health and act accordingly to the results that we actually see.
With current health, you're getting real-time information. It allows the consultants and the clinicians to get information right away, and it's on a number of occasions helped us out, because what it's done is shown us a trend. You know, initially when you look at the figures, it's only a number, but if you look at the trends, you can see when a patient's becoming better or ill over a longer period of time, because sometimes it's 2 or 3 days or even longer they're on the system.
Well, Norma hadn't been well, and her daughter took her to the doctors, and when she came back she says, we're going to get a hospital at home. Never heard of it, hadn't a clue what it was about. I would say that if anyone was considering taking it, that to take it, because it was an excellent experience we had using it.
They said you won't even know it's on you, and it was true. They were true to their word. It was on all the time, and you wouldn't know any bother at all. It was really wonderful. I can't praise it enough.
Unlike the old-fashioned wards where you could see every patient down the ward and you knew how they were and knew when Mrs. Brown was not looking so good, this is kind of our equivalent to that oversight, that little window that allows us to see on a dashboard, John is looking fantastic today, that's really good news, he's got better. So having that oversight of all of our patients, I think gives an enormous amount of reassurance that we can manage our current workload better and more safely because we know what's happening to them.